Afternoon. This is Ian R. Crane, and it is the afternoon of Sunday, the 12th of July, 2020. You'll have to forgive me. I really struggle to maintain concentration. Unfortunately, the pain medication that I have to take really does have a lot to answer for. But I wanted to get this live stream out this afternoon for a couple of reasons, and primarily it's to say a truly massive thank you to all those people who have donated to the crowd fund, which was set up at the prompting of Brian Gerrish and a number of other people to help finance the alternative therapies that I wish to pursue. And unfortunately, of course, radiotherapy is the only option being offered by the oncologists, and that's not my preferred option by any stretch of the imagination. And I'm pleased to say that thanks to the massive response when the fund was initiated last Sunday evening, so in fact at 9:15 tonight, the fund will have been going for exactly 1 week. And thanks to the tremendous response, I was able to start a 6-week course of treatment last week. And I should be shortly heading off in readiness to undertake another week's course of treatment commencing tomorrow. And this wouldn't have been possible really without the tremendous support that I've had. And I can't thank you enough. I struggle still to control the emotions, and obviously the gratitude is also shared by my family. And it's not guaranteed, obviously, that this course will work, but thanks to the generosity, I've been able to seriously consider a further course of treatment should the outcome of this first course not necessarily achieve the desired results. And a number of people have asked me to share specifics of what treatment I have elected to take. And please forgive me for not being too open about either the treatment or where I'm receiving it. And really, the reason for this is because the MHRA, the Medicines and Healthcare Regulatory Authority, are determined to shut down any effective cancer treatment. And of course, they're able to do this under the guise of the 1939 Cancer Act, which was set up to effectively protect the radium industry and create this phenomenal revenue stream for the big pharmaceutical companies. And the profit margins from pushing chemo and radiotherapy as the only courses of treatment are enormous. And of course, David Noakes and Lynn Thayer are testimony to the lengths to which the MHRA and the pharmaceutical industry will go to ensure that effective treatments do not make it to market. More of David Noakes and Lynn Thayer, if not today, then probably next weekend. But regrettably, they are, of course, holed up in jail just to the south of Paris, with currently no sign of a release date. And the likelihood is that Judge Goddard will ensure that they are kept in custody until such time as the trial hearing. And of course, French law has this really strange quirk where the judge is effectively the prosecutor as well. So we could pretty much determine the likely outcome of that. But I also wanted to make the observation that any excess funding that I don't need or am unable to use for whatever reason, then it will go towards a trust, and the trust will be set up, and the trustees will have the horrendous responsibility of determining deserving cases, because obviously there are many deserving cases, but the funds will be available to people, hopefully, who have elected to not pursue courses of chemo radiotherapy, but whom have done their own research. So it would be a case of they would need to state categorically what their preferred course of action is instead of chemo radiotherapy, and then the trustees would effectively have to make the decision as to how those monies are spent. But meanwhile, I am obviously determined to get my health back to where it should be and get myself back into the fray and resist this totalitarian globalist regime that is manifesting and, of course, determined to remove fundamental liberties. And the primary topic of this short broadcast today is to draw people's attention to Boris's crass attempts at shifting the blame away from himself primarily, or Dominic Cummings if you prefer, but shifting the blame away from himself for the horrendous death toll of people in care homes as a result of the coronavirus. And I was following this quite closely when I was in hospital, and I was appalled to learn that basically the government was effectively directing local authorities to force care homes to take people, elderly people who had been tested positive, to take them into their care homes, even when they had made tremendous attempts to ensure that their respective care homes were corona-free. And Boris is basically now realizing that there's likely to be a public inquiry into the massive number of deaths in care homes, and he's already starting to try to shift the blame by stating that these care homes didn't follow procedures. Well, it doesn't actually take much effort in terms of research to establish that Boris was the one establishing the procedures from the get-go, and those procedures were pretty pathetic, to be honest. What they were trying to do, supposedly, was keep the beds in the hospitals free for the massive influx of people as they became affected by this pandemic. Now, of course, that massive influx never happened. So what happened was that people were being forcibly pushed into care homes that were effectively corona-free and introducing the virus into those care homes. And obviously, by definition, those people were vulnerable. And, well, it didn't take a rocket scientist to work out that this would lead to a massive increase in the number of deaths. And I want to, just draw your attention to a couple of articles. That's what happens. My brain operates at a different pace than my mouth, and so words get a bit jumbled up from time to time. But a number of articles. But let me draw your attention specifically to an article that appeared in The Guardian on Thursday, the 2nd of April. And the article was titled, UK Care Home Bosses Threaten to Quit Over Return of Coronavirus Patients. So this is people who were being tested positive in the care homes, being transferred to the hospital, but basically were then being told, well, you know what, best place for them is back in the care home, which made the care home gave care home that enhanced vulnerability. And an article that appeared on Sky News just a week later, on Tuesday the 7th of April, and people were latching on by this time. And the headline of the article was Coronavirus Sacrificing the Elderly as Care Homes Asked to Take COVID-19 Patients. So here we are, basically 3 months ago, and it was really evident to anyone watching this unfold that this was going to result in massive numbers of deaths. And, you know, satire has a place. And I have to say that I think Mark Steele, that's Mark Steele, the journalist, not Mark Steele, the 5G campaigner, but Mark Steele wrote an absolutely superbly poignant piece which appeared in The Independent a couple of days ago. And I'm going to read this to you because it is online, and the title is "Care Homes Are Totally to Blame for All the Coronavirus Deaths. It's their fault for following government guidelines, government advice." So the headline may be a little bit misleading, but let me read the article to you. Much of the world is puzzled as to why we in the UK have had so many people die in care homes. So it's a relief to know that they did it themselves. The idiots. They probably served up bowls of coronavirus instead of custard and told residents that if they had a tickly cough, they should relax in the bath whilst cuddling an electric fire. And yet Boris Johnson offered clear guidelines, such as you can't catch the virus by shaking hands with infected people in care homes. And that is a direct quote. If only they'd follow that advice and ask the most infected people to rub themselves up against the other residents and maybe organise naked Greco-Roman wrestling tournaments for maximum bodily contact, they'd have all been fine. Another clear guideline was to announce that elderly patients in hospital who tested positive could be admitted to care homes. Then how did the care homes interpret that? They thought it meant that elderly patients in hospital who tested positive should be admitted to care homes. That's the trouble with some people. They don't know how to follow simple instructions. Some people have criticised the government for pouring infected people into care homes. But Boris Johnson replies this isn't fair because this happened before we realised how the virus worked. This makes sense because back in April, who could possibly have guessed that the people who might spread the virus were people who had the virus? It's all very well being clever in hindsight, but until then, lots of us thought that the people most likely to spread the virus were people who didn't have it. Or perhaps it was sentence missing apparently in the print. Luckily, this deadly advice was aimed at a sturdy section of the population, the elderly, who are too frail to live at home and are all squashed up next to each other in care homes, so couldn't do much harm, could it really? As long as the obviously infected other hospital patients who didn't have coronavirus symptoms were sent back to care homes without being tested. The government instruction was negative tests are not required to transfer people back to care homes. So the care home staff interpreted this as meaning negative tests were not required to the transfer of patients. They should have realised this was a crossword clue, perhaps. The next instruction, probably Russian queen mixes violin with panda juice. In fact, the care homes would have been better off if they'd been given guidelines by the people who issue instructions for putting together an IKEA bookcase, such as attach an 89-year-old B to walking frame pinion ratchet F, folding it up towards back nodule virus prevention symptom bracket Q. Makes clear sense, eh? Boris Johnson now excuses the policy of sending patients back into care homes without being tested by simply saying, we didn't know you could carry the virus without having symptoms. But 1 month earlier, the government's own scientists insisted that people could have the virus without showing symptoms. Maybe the government didn't have the time to listen to all those boring announcements for scientists. On and on they went every day about flattening curves and keeping 2 meters away. You can't expect a prime minister to take notice of all that twaddle while he's got a pandemic to sort out. Instead of following boring science, Johnson has made clear all the way along that 4 weeks before we had to shut down everything, He stated we shouldn't shut down anything as we could become the Superman of Europe. That's the way to explain things with fun language that anyone can follow. Well, please, as is always the case, do your own research. But it's become abundantly clear to anyone who looks at this care home apocalypse that this was clearly part of the agenda. So what we have experienced is a culling. And actually, I don't believe that the culling was anything like the desired level of culling. So the anticipation was that it wasn't just going to be people in care homes, it was going to be a generic culling. But as of course it transpires, it is the elderly and the people in care homes who are indeed the most vulnerable. And what has proven to be the case is that children are the least vulnerable. So consider my shock when I saw an advert on Leeds train station the other day from the World Health Organization claiming that they wanted donations to help protect the most vulnerable against the coronavirus. And who did it state as the most vulnerable? Children. You couldn't make this up. There is after contradiction after contradiction. And the only reason to even look at the mainstream media is to experience the magnitude of those contradictions for yourself. But dig deeper, as most people, if not everybody watching this will do. Dig deeper, do your own research, look at the deeper agenda. There are people, Dominic Cummings, Boris, perhaps, gagging for the second wave. They want to be in the chair when this massive second wave hits. Meanwhile, of course, the economy is being destroyed. And having had some conversations with some economists in the last week or so, it's my guess that my estimate of 6 million unemployed when the furlough scheme ends in October is perhaps a massive underestimation. And only then will the true magnitude of this economic travesty be fully understood. And Rishi surely thinks at the moment that he has open access to the magic money tree, and you can see the increasing hilarity amongst economic commentators who know how the game works, and starting to ridicule Rishi's open access to the magic money tree, because as he's being observed, it's going to have to be paid for somewhere, and it ain't going to be the wealthy who pay for it. It's going to be everyone else, i.e. those of us at the lower end of the food chain who they are desperate to cull. So thanks for joining me this afternoon. This live stream was a little bit longer than I intended, but the magnitude of the care home apocalypse, the magnitude of the economic apocalypse is not yet being fully realized. And I, of course, encourage people to do their own research and to absolutely tune in to UK Column at 1 o'clock every Monday, Wednesday and Friday. And I have to say that the guys at UK Column are absolutely on the ball and on the money. And it's wonderful to see their viewing figures increasing exponentially. But it's also wonderful to see so many other new commentators, and especially so many young commentators. The ultimate target here in the short term, yes, is the elderly. And, obviously the global corporatists are desperately trying to give us a one-way ticket to, the next great adventure. But those who are going to suffer the most in the longer term are, of course, those who are only now in their teens, pre-teens, and maybe looking to start a career. And the likelihood is that for many, many millions of those, the only career they have to look forward to is universal credit. We need a miracle. Collectively, we have the capacity to provide that miracle, because collectively there is enormous creativity amongst us, and that is what the establishment is desperately trying to shut down. So I ain't giving up by any stretch of the imagination. It's a little more difficult for me than it was a few months ago, but I shall keep doing what I need to do to stay in the fray and encouraging people to do their own research and then sharing it as widely as they possibly can. So thanks again, and thanks again for all those who have dug deep to contribute and donate to my crowdfund. And my live streams are going to be a bit random, but I will absolutely, God willing, be back with you next weekend at the very latest. You take care now.